We're at the CROI 2017. We're here with Phil Wilson, who is actually not attending the CROI, but you're working with some of the young investigators. You're with the Black AIDS Institute, so you have a real interest in those people who are attending the CROI, who are going to get the scientific facts and who need to bring those back out to the community. And you gave them a pep talk, I'm sure, and some information on how to make all this happen. So let's get right to the meat of it. We have a population that's needful, that needs to be addressed, and let's talk about that.
Absolutely. The Black AIDS Institute, this is the third year that the Black AIDS Institute has co-sponsored a program with AVAC to increase community participation at CROI. We have young folks who are educator and treatment advocates who we are providing a program that includes daily updates and supporting them through the different sessions during the meeting, and also supporting them to take the information they gain here in Seattle to disseminate it in communities all over the country, and to support activities that generate actions that actually assist us as we continue to move forward toward hopefully ending the AIDS epidemic as quickly as possible.
We obviously what we do is video, so we have to talk about that. I think we did touch on it a few times, but I think we should find a way to get, obviously the people that come to the meeting are worthy of coming to the meeting, but there are also worthy people out there who don't get to go to the meeting.
Exactly.
Who might be able to pick up in some sort of a video seminar that for instance, what you did this morning, kind of like bring up the issues that were most discussed, and also, like you say, the facts that were laid out at the conference in science, and we could get that out to the people who don't get to attend it.
Right.
So let's work on that for next time. But it's a moving target.
But let's stop with what because I do think it's important for us to be clear at what you said. So as important as it is for the information that is communicated at this meeting to be communicated, okay, it is important that we extend the reach of that information. It kind of goes back to the analogy, if a bear poops in the woods, does anyone hear it? Or if a tree falls and no one hears it, does it actually make a sound? And that is true here, that if CROI is only about the talking heads talking to each other, it is not going to have the impact that it needs to have in communities that desperately need this information if we are to have any hope of ending the AIDS epidemic. So how do we extend the message? And that's what I think you're doing here, and that we're trying to do at the Black AIDS Institute, to extend the message as far as we can and to identify message extenders. And that's what our program that we're doing with AVAC does. It basically says that we have people who are connected to communities. They can come here, get information, and then they can transfer that information to those communities.
And at a level that they're willing to accept at that point in time, because it's very scientific here. Obviously, it has to be translated. But I think while we do that, I think we need to bring the level of understanding and science in the person's mind that attends the conference up.
I think there are two things that needs to happen. One, I think that we've been doing this now for 17 years. We've discovered that there actually is a capacity that exists that people don't understand it does exist. So we shouldn't underestimate the capacity that's in communities. No. Number two, even while we say that, it is important that we do translation, and it is equally important that we raise the science and treatment literacy. So it's a three-part process. Not assuming that people can't absorb the information, because they can. Now, in places where people need assistance in raising their science treatment advocacy, science treatment, science literacy, let's do that. And at the same time, let's figure out how to translate the science into English. Right. So that three-part process is important.
So when we do this, I think over time it's going to change. And I think the one thing I find a lot of populations out there that watch our shows will say, that wasn't what you told us the last time. That science, and I think the one message we have to keep on hitting back and back is that science changes. That's why we do research. Because it may be an answer that we thought we had, but it'll change a little bit, so we have to be ready for those changes. Just the way we aren't ready to announce a cure.
Well,
there will be a cure.
The interesting thing about that, and you're right, people say that things have changed. That must mean that what you told us before was false. But I'm a trekker, and so I do mountain climbing. And when you do mountain climbing, a lot happens that there are switchbacks. And so you're doing a switchback, and you think that you're at the top of the mountain. And when you go across the switchback, what you discover is that there's just another switchback. Now, the top of the mountain hasn't moved.
No.
The top of the mountain is where it always was. The answer in science is still where it always was. It's just that we have a different point of view.
Right.
And so what happens as we learn more, we discover more that we don't know. It doesn't mean necessarily that the facts are changing. The facts are not necessarily changing. It's just our perspective about them is changing. And we need to communicate that to people.
And as we know it now.
That's
I mean,
right.
that's so science is always evolving. But I'm really hopeful that you can find a way to get the messages out to the young people. I think that's one of the things. It is so crucial, like you said, that is the most needful population. And I think addressing that, well, you know that only too well, and I think that's probably what you ought to communicate out to our folks. This is a population that is really, really in need of attention, education, further information.
And part of that is embracing that the messenger matters. You know, that the way that we're going to communicate, transfer this information to young people is to find young people and make sure that they have the skills and the capacity and the knowledge to actually to talk to each other. You know, we seem to understand, although sometimes I wonder about that race matters. We certainly understand that linguistic language matters. So we wouldn't try to talk to someone who's monolingual Spanish speaking or monolingual Italian speaking or monolingual Russian speaking and present them information only in English. We would never think to do that because we would understand that they wouldn't understand it. Well, there's cultural language as well, you know, and so if we don't develop a cultural humility and be responsive to cultural language, our messages are not going to be understood as either. And then and in that line, the messenger matters. You know, so your ability to communicate to me, in part, is determined by how much we have in common. You know, what is our cultural and lived common experiences? Otherwise, it will become more difficult for me to believe that what you're saying to me relates to me. So, do we have similar age? Do we come from similar places? Have we had similar economic experiences? Certainly, do we have similar racial experiences or gender expression experiences, or all of these things? Many of them get written off as being irrelevant, and they are very relevant. If for no other reason, we have an epidemic that we need to respond to in an expeditious manner. And so proximity matters. You know, and so people who look like me and have my cultural experience, they're more likely to be in proximity to me and therefore can communicate information to me in a more expeditious manner.
And I don't know all the nuances, but I do know that over the years I've learned that there is, in this Hispanic population, there's Mexican, there's Cuban, there's Puerto Rican, and sometimes they're at odds with each other. And I think the dialects and so forth, inflections, and like you say, the trust, you know, it needs to. So we had a program last night that we had a young Puerto Rican guy on with, speaking on the Spanish program, with doctors from Spain. So it was, I made sure that they were all comfortable with this. But he does want to get the doctors from Puerto Rico to talk with him so that he can really use that a little even more effectively.
Absolutely.
In Puerto Rico. So I think similarly, you want to have Black African women talking to others and the age, similar ages. So it's a lot of, the nuances are really important. Getting the communication going right, and the words, the message.
That's right.
Which I think,
and the platforms to communicate, you know, so that, you know, generationally there are differences.
Huge.
And so understanding the difference when folks who prefer to receive information through traditional paper processes and folks who actually don't read paper anymore at all, that they want to receive their information electronically. And people who prefer long format information and people who prefer short format information like on Twitter, et cetera, et cetera.
Right.
And so figuring out ways to deliver the messages on platforms that resonate with the audiences that we want to reach. For too long, what we try to do is we try to bring communities to us. And now we need to figure out how to be relevant in communities. however we define those communities, and part of that is by going to those communities, but part of that is building the infrastructure and the capacities within those communities. The motto of the Black AIDS Institute is our people, our problem, our solutions. And while we're ecstatic around having advocates and allies, we absolutely understand that a sustainable response in Black communities will require a sustainable infrastructure and capacity in Black communities. And we need to figure out ways and continue to figure out ways, as we have for our entire history in this country, of how to save ourselves. And so we're building the capacity in Black communities for Black people to save themselves.
So do you do like focus groups or surveys or things like that you can get a sense of where people's interests are and so forth?
We do focus groups, we do surveys, we do key informant interviews, we do user analyses, we do consumer evaluations, we do satisfaction surveys. But first and foremost, we are of the community. So right now, when I look at my staff, we have programs that are targeting, Black gay men who are living with HIV, and roughly 40% of my staff, are Black gay men who are living with HIV. 80% of my staff are under 30. And so part of it is doing translation, and part of it is being of the community.
So I'm hopeful that we can work together.
Absolutely.
And that the messages that you come up with can be used as models and expanded with assistance from the federal government, wherever you need to. Because
let's knock on wood with that one.
Well, right, and we've gone over that. That's pretty hard. We have to find a way to communicate to people to let them know there is such a thing as truth.
Right.
And there's such a thing as science and truth in science. And it is so critical that we abide by that.
That's
if
right.
we don't, we're lost.
That's
There's
right.
nothing else.
That's right.
The only thing we have to live with here in science is the truth.
That's right.
And that's what happens. This conference has peer review process, which means a doctor goes up to a poster where some guy's standing and he's trying to pitch that what he's done is legit. And this guy is going to say, wait a minute, you looked at this, and I don't know if you looked at this the right way, or didn't you overcompensate here? There's a lot of discussion that goes on. That's what we call by a peer review process. And then, of course, they present, posters are presented in big rooms where they have people that come up and ask questions later. It's an important piece of it.
It is an important piece of it.
It's getting to the truth.
It's important. And a part of it, I think, particularly at this time, is understanding the connection between the science and public health and implementation, and what's the impact of that. So, for example, there's a big conversation today about cure science. But here's the deal. We can do as much, we can actually be extremely successful in cure science, but if we dismantle, for example, the Affordable Care Act, and we remove the possibility that people have access to care, then all the cure science success is going to not be, it's not going to help us get to the end of the AIDS epidemic, because at the end of the day, whatever we discover in cure science is going to be implemented in a public health delivery system. And if we dismantle that system, we're not going to get the job done. So there's a connection. Right. And so that means that the people who are working on care delivery need to understand the science, and the people who are working on the science need to understand the care delivery.
So we need culturally specific and culturally sensitive systems that have taken time to build up.
That's right. And we need seamless networks of information transformation that happens from the actual patient level to the bench science level.
Right. Listen, Phil, we really covered a lot. I think we want to make sure that people hear what you've got to say in the length and breadth of it. So the contact information we have for your website we'll put up on the screen as well. And we encourage people to contact you. If they're in a small community somewhere in the country that they feel lost, there's got to be a way for them to connect.
Absolutely, and we do programs that we can reach out to you no matter where you are, no matter who you are. We can work with you. We sponsor monthly webinars every month of the year. We sponsor a webinar.
And that you can do from anywhere.
From anywhere you are. We have trainings where we bring people in from all over the country to train folks. We have leadership programs. We produce reports all the time. You can find us on the website, www.blackaids.org. You can also find us on Twitter and on Facebook. Facebook and on Instagram. But we invite people to join us, and we are a resource. We can come to local communities to help people. We do that all the time in our training and capacity and infrastructure building.
The more you're challenged, the more you need to accept that challenge.
That's right.
And I want people to accept your challenge.
Absolutely. Thank you.
Thank you, Phil.